Hello, welcome back. Here we are with part two, another family caregiver talk. Hello again. My name is Donna Mitchell from Aging Advantage. Aging Advantage is a nonprofit organization that helps support seniors and disabled adults in the greater St. Louis area. And through the local grants and donations, we are able to provide these types of educational talks to our clients and their caregivers. And today, we're going to have Jennifer Martin back again to continue the talk about understanding pain, mobility, and aging. And Jennifer, once again, once you're finished, I'll come back on and we can see if we have any questions, comments, anything of that nature. But until then, it's your floor. Thank you again, Jennifer.
Awesome. Thank you, Donna. I appreciate it. And thank you guys for putting on, these educational presentations and talks. I think it's just so helpful for the case managers, caregivers, and actual the clients too. So thank you guys for taking the time to do these for everyone. So this is going to be part two, as Ms. Donna said, about understanding pain, mobility, and aging. And on this part, we're going to focus a little bit more on like simple strategies that people can do for their everyday life to be able to kind of move those things forward. So why daily pain strategies even matter in care in the first place? So obviously, as we discussed before, pain drives a lot of inactivity and then decline, physically and then mentally also for the aging population, unfortunately. And like these little small habits that they can get into, good or bad, right, can really influence their long-term outcomes, which is what we're trying to affect in a positive way instead. So obviously the caregiver role is very, very key in being able to support, again, mentally and physically, the well-being just overall of our patient. So things that we also need to pay attention to as well in terms of these daily strategies is, joints, like we discussed in the previous presentation, but we need to, you got to use it or you lose it. We want to keep the joints moving. We need to keep the muscles moving. We need to keep all of our strength built up. And we need to do all that obviously as well in a safe environment with safe resources, and resources maybe being, like a walker, a cane, things of that nature, grab bars, etc. We'll get into some of that. But being able to just have the caregivers and also the clients, patients themselves surrounded with good resources, physically in their space and in their immediate environment, and then also people that they can access, like other doctors or programs, social activities, and things like that to help them to continue to stay strong and preserve their independence. And ultimately, what we try to do, obviously for patients as well, is really to reduce the amount of hospitalizations for patients, and also injuries and all the doctor visits. Some of these poor older people, man, they are going to so many doctors. And, we don't necessarily think about it as a point of stress when we're younger, but it can really be like a huge burden on the caregivers and, also obviously the patient, the client, but the amount of time that it takes to have these people be able to commute back and forth to all these appointments, etc. So the more we can kind of help to minimize those things, the better. And from a healthcare standpoint as well, I'm going to talk about this for a quick second. What a lot of people don't realize on the non-medical, non-hospital side of things is that if a patient, like let's say, we'll call her Ethel, goes to the ER today because she has, I'm going to make this up bad, but like heart attack, okay, or something, right? Or whatever kind of condition it is, right? That she has. Maybe it's a wound thing, whatever it's going to be. But she goes to the hospital today, ER, for that exact for that kind of condition, right? If she goes back within a certain time period as well, with that exact same kind of diagnosis, exact same condition, then that would be kind of considered kind of like a readmit for the same kind of situation. And shocker, not shocker, insurances then don't want to pay for continual like readmissions basically of the same kind of conditions. So, we have, and okay, well, first of all, I'm going to say, is that necessarily right on the insurance people's part or not? Who knows? I'm going to just, throw that out there. I don't know. Maybe, maybe not, right? But we have like a, I don't want to say social responsibility, sort of, as caregivers and as case managers and all the things like that, to really help these people to be able to get the right tools and resources to kind of help take some of that financial burden off of our hospital systems, because it's really one of the reasons why some of our hospitals are not doing as well fiscally, just because they have to keep saying the same things over and over. But it's like, how do we help take responsibility for those things better outside of the hospital kind of care setting? So anyways, enough of that. But just to kind of help you understand a little bit of the why, in terms of why some of this stuff is really, so important. So today we're going to be focusing on, for this presentation, kind of some practical and just kind of realistic solutions that some of these people can do. First, we're going to start with the posture. So posture alignment and joint loading. On the left-hand side here, you'll see a picture of a person. She looks kind of younger. She's standing upright. That's great. Middle age, we start kind of seeing this like curve, or in the previous presentation, you heard me talk about that, is called like kyphosis, right? So when they're really starting to like hunch forward. And then as someone ages, this very last one, sometimes again, we see the discs in the spine start to degenerate, those disc spaces, things will kind of start to fuse like that. And then we get improper loading on the force, that, those joints have to withstand in the spine. And then we'll get some of the arthritis, et cetera, et cetera. But it'll cause, the more we get to the picture on the right, it's going to cause more uneven joint wear, more pain, more pressure. Obviously, you have muscles attached to all these bones, including your spine. And so when you're, like if your head is nice and upright, that's fine. But then like think about, well, we'll go this way. Think about like in terms of like if this was your muscles, right? The more forward your head goes, then the more pulled and strained those muscles are going to be in your back, especially your middle to upper back neck kind of area. The other thing too, when you start going forward like that, as we remember that the spine model from the last presentation, as you continue to basically get more kyphotic, or you lean forward, those holes where those nerves are trying to come out on the sides of your spine are going to also narrow. And so that's going to pinch those nerves, and they're going to get a little crabby. So that's going to potentially cause, like I said, in the neck area, if you do this, it's going to cause, shoulder, arm, hand kind of issues. In the lower back, when we start to see that narrowing, you're going to see leg, you're going to see, well, buttocks, leg, and then also foot issues as well. So just also for older people too, breathing is always a big issue. But the more space, obviously, the more upright you can be, you're going to provide more space for the lungs, like we talked about, to be able to have those diaphragm muscles to be able to fully contract and relax, and for the patient to be able to get a lot better, improved breathing and a lot better breath as well, which is going to be key. They need oxygen as much as possible, especially when they get older. So that's kind of another just awareness for awareness, and also sometimes too, just a good reminder for them of why they need to, kind of get upright for them as well. So yes, the ergonomics and the biomechanics as they get older is key. But yeah, the more we can keep them more in that upright kind of posture, the better. So we're going to talk about some functional movement principles here. So things to keep in mind, like I said, from an ergonomic standpoint, and while you're moving your body around, try to, bend and use your hips instead of using your spine. So, that's things like, bend your knees and, it's going to sound, but bend your knees, like stick your butt out and then lean forward to pick something up instead of just arching, and bending your spine forward, keeping your legs straight and just really bending at the waist. You don't want to do that if possible. You want to try to use your whole body to get down on the ground as close to the thing as possible that you can, um, before you're gonna like pick something up. So the other thing is too, you want to keep the objects close to your body, like how these people in the picture here, they're holding their little donations boxes. Um, Volunteering is great as you get older as well for the cognitive and also the social aspect. But I digress. Anyways, the more that you can keep stuff how they have the boxes like close to them, that's going to be better, especially as someone ages as well. It's going to help them feel more stable and more balanced than if they have something out here and they're trying to navigate it, can kind of throw their balance and proprioception off sometimes. Um, a big key that we hear a lot throughout lifetime is you don't want to like twist and you don't want to twist and bend at the same time or twist and lift. You want to, in theory, instead you want to pick something up straight in front of you and then move your little feet. So move your little feet around so that you can twist, then to be able to face the other direction and put the object down or carry it wherever you're going. You don't want to pick something up and then twist and then, with your body keeping your feet planted where they are and then twist and put something down. It's just going to put more increased pressure and strain, inflammation, etc. on, on your back. And some of those other joints too. So also push through the heels to stand. Important. You want to make sure when you're going from a sit to stand position, you want to make sure to keep your feet obviously flat on the ground, but you want to make sure you're kind of pushing through your heels and then transferring all that weight onto your whole foot. So you're engaging, your hamstrings, you're engaging your buttock muscles and quads and everything to be able to help you. And if you need, you can use the armrests or supports to stand up. Some older people as well that have the little rollators that can lock in place. Lock it first, number one, but then they'll sometimes also get that walker closer to them and then be able to use the arms on there to be able to help support themselves from a sit stand position, which is good. And your movement quality matters more than your speed, and I'm going to talk about that for a quick sec here. So with that being said, patients, as they age, right, they'll start walking a little bit differently. So we call that gait. We're going to start seeing them move around differently. Sometimes they'll just try to like hurry from one side of the room to the other side of the room or something. And in doing that, they will kind of like do a little foot shuffle maybe. And in like, depending on like what their condition is, like maybe they have Parkinson's, maybe they have something where they're going to just kind of neurologically do that anyway. That's a whole nother video we'll get into, a whole nother presentation that we can talk kind of about gait, what that means, etc. But what happens when the patient is doing that kind of shuffle kind of activity is they're not doing an actual like heel toe strike where when their foot hits the ground, they should hit with their heel and then rock through their foot onto their toe and then kind of push off with their toe and then bend the knee, bring that leg forward and then hit the ground again with their heel and then continue to kind of almost think like of it as like a rocking kind of motion that they're going to do with their foot. When they do that kind of motion, which is good, we like that, that helps to engage, their calf muscles, their quad muscles, the buttocks muscles, the tibialis anterior, which is, when you think of shin splints, it's that front part of your lower leg, right? But it helps to engage all those different muscles and your foot muscles too, that we need to keep strong for balance purposes and proprioception and all the things. So, so just making sure that they slow down and walk through like full motions to be able to engage some of the muscles, just doing basic normal activities like they normally would do is huge. And even again, like we talked about the sit stand, right? Um, like yes, if they need something to be holding on to, bars or something like that, the arms of a chair to be able to help push them up from a standing, to sit to stand position, that's great. But I always think as much as possible, if they need to kind of like touch it, just lightly touch it for stability purposes, that's better than just solely relying on that to push themselves like up, because the light touch or not trying to grab onto anything at all, unless if they feel unstable, like they're gonna kind of fall, allows them again to utilize all those muscle groups when they're just doing that simple basic activity of like I said, sit stand or doing a transfer from bed to a wheelchair or something like that. So just the everyday little activities that you and I take for granted for patients as they continue to age, it's actually all kind of physical therapy slightly, if they just go a little bit slower and really like think about engaging and feeling kind of some of those different muscle groups. So things to keep in mind. Oh, here's those little grab bars that we just talked about. So exhibit A. Anyway, but there's different things though that they can use, obviously, different tools that we have available. There's been some really cool inventions that can really help some of these people that do experience pain or challenges in their mobility and kind of functionality. So one of the things that is great is like cups with large or double handles. Again, we talked about that in that sometimes they need to be able to hold the cup in one hand. That's good, but where they can hold it, maybe they're gonna put a hand underneath the cup also too. But having something or where they can slide their hand through is going to be good. So a lot of, like I said, a lot of patients, as we talked about, also in the part one, have some kind of osteoarthritis happening or rheumatoid arthritis. Rheumatoid arthritis being more an autoimmune type of function, and again, we can totally get into that at a different time, but kind of different mechanisms slightly, but outcome still the same. So we're going to have a lot of, joint swelling, a lot of pain. It's going to be really, really hard for them sometimes to bend their hands, and especially bend their hands and grip at the same time. So that's where we then can get, utensils, utensil grips that are going to be bigger for patients. Also, there's different things they make, like electric jar openers. They also have really cool gas cap, like attachment things, and also like key turn assist tools nowadays as well, that are just fantastic for older patients that again like have some of these hand like pain challenges. So button hooks, zipper pulls, again, things that you and I might take for granted, like I'm just going to zip up my jacket, call it a day. They can really struggle with, and it can really cause them a lot of pain. And so sometimes you'll just see them then just not put on a jacket, or you'll see them constantly like putting on sweaters, and you're like, it is 22 degrees outside, like it is in St. Louis this week. Like, why are we just wearing a little light sweater? Um, it could be because they literally cannot do, and they can't pinch, they can't do the zipper. So things to be able to just pay attention to, like what's kind of going on, what are you seeing, and what can be modified to help give them more independence and let them be safe in their environment, which is pretty neat. Also, we see on the little right hand side here this little cool grabber. These things are wonderful. You can use them for all kinds of stuff. My parents actually even will use them to pick up sticks in the yard. It's fantastic. They'll like walk around with two of them, pick up sticks, pick up gumballs, whatever. You can use it inside, outside. All kinds of applications. Obviously, a lot of times we think of it in terms of if you drop something and you can't get on the ground, you're going to use a grabber. However, like I said, they can be used in a lot of different applications for somebody. But again, if somebody has like massive hand arthritis, they're not going to be able to repetitively grip that thing. So things to keep in mind. But if they drop something or need to get something over there, they can use it to fetch items and bring them to them if they need. Another great tool, again, for some of the aging people as well, are these bars. You'll see sometimes, obviously, these bars installed into walls. There's the grab bars that they have that can be installed into showers as well, just to give them a little bit more stability. Also, this is not a necessarily an example of it, but they have like the raised toilet seats, um, and things of those nature, or shower chairs, stuff like that, that can assist as well. But the raised toilet seats, again, being things that are higher like that, or the recliners that are super cool nowadays, where not only do they recline, but they also can do the opposite and they can push you up and out. So instead of going back, you're going to go super up. So you can do it the other way, and the chair will actually rise up and then kind of, pop you out, and then you're standing up in your recliner nowadays as well. But sometimes some of those tools can be helpful. But again, kind of double-edged sword here. If the patient still has like the functional muscle capacity, um, to some extent, and it's not causing them a lot of pain, obviously, to do the activity, it's kind of better if they can still do the activity on their own, because then again, they're utilizing all those muscle groups. They're kind of doing a little PT on their own, and helping to keep them strong. Whereas if they just kind of skip all that and then they just they can do it, but they just don't. They choose not to because of the inactivity aspect, not the they're deconditioning themselves, but because of the inactivity, because there's an easier way out, and they're taking the easier way out from a long-term perspective. Like, that's not going to be what we're trying to do. So, it's kind of a delicate balance, but just in looking at some of these kind of tools that we have, look at what's going to be a safety concern, what's going to be like, we need the grab bars, we need just different things like that, to keep it safe for the patient, versus like, okay, what are we just getting like a little bit lazy on potentially here from like a deconditioning inactivity standpoint. So just kind of things to keep in mind as we are just talking about some of these like resources for people. But so many cool products nowadays. Another thing, so bracing and mobility support. So also in terms of like, what kind of resources do we have? We have all kinds of really cool braces nowadays as well. So we have like knee braces. Sometimes you'll hear them called ROM, or range of motion knee braces. We can actually restrict how far the knee can bend, forward, backwards, all the directions, so that if a patient gets pain going past, a certain degree of motion in their knee, we can just stop it right before it gets to that kind of zone, if you will, or angle of range of motion, so that it helps decrease pain and then decrease the inflammation and all the things like that for the patient. So pretty cool technology in terms of those things. Those have kind of been around for a while. Different like wrist and thumb braces and all kinds of different braces like that for arthritis, and kind of to help protect for that. There are ankle braces, and then there are also, I'm not going to use all the fancy words for you, but I'll kind of explain what it is. There's also kind of like an orthotic kind of, I don't necessarily want to call it necessarily a brace, kind of it is. But anyways, where it will like attach to the like lower leg kind of area, ankle kind of area of a patient, and it will help to like slide under their foot in the shoe, to be able to have it so where when the patient steps on the ground, It can actually have like a little kind of pad thing in there that will vibrate, so that the patient can feel that motor vibration sensation. Um, and from a proprioception standpoint, then they're able to better control their balance, and their stability and their gait. And it makes it safer for them then to be able to walk still independently, kind of like on their own. Maybe they would have a cane or walker or something too, but it still allows them to be able to be upright. You, again, moving, right? They're walking, they're using all their different muscles, as opposed to them just, okay, forget it. I can't feel anything. I'm just going to automatically go into like a wheelchair situation, right? So we have a lot of different cool things like that. And sometimes those would be like your patients with neuropathy, where a device like that might really be able to like help them. So there's different, like I said, neat things that we have, nowadays, for patients. But one of the other things that we've had around for a really long time, as you guys know, are our walkers. And now we have our cool rollators with the, four wheels on them that can go in all the directions and lock and all the stuff. One of the things that patients routinely do with these walkers, however, is that they will put the walker like way the heck out in front of them and lean over, back to that kyphotic kind of forward leaning position, but they'll lean way forward over. Um, and You don't want to be doing that. So it's better to have them, if possible, get the walker like as close to them as possible. And even bonus points if possible, to get their body kind of in the middle of the space, slightly where that walker is. So try to get them to be upright if possible, and not put a ton of pressure necessarily on the walker if they don't have to. Just kind of have it their shoulders relaxed, and just have their hands down. Make sure also that it's going to be at the right height, so that they're not like, hunching their shoulders up when, if it's too tall, when they're trying to use the walker. Same thing with a cane or something like that. That's going to cause way more stress and muscle tension, pain potentially in their like upper neck, upper shoulders, kind of upper back area. But again, it's key to be able to have them inside the walker, so that they can, like I said, better again utilize their own muscles, work on that core, work on the abs, work on their back muscles to stay upright more. So that's going to be key. With that being said, really quick, I'm going to also just mention this, that there are some patients, again, like I said, they can be fused spine wise into that kind of kyphotic, position. As their spine degenerates, they can just kind of get stuck, in that forward kind of position like that. It can happen. But also, what will happen a lot, and what you're going to see a lot, is as patients continue to age and as they progress, they're going to, again, sometimes from like a neuropathy standpoint, etc., can be other things too, like if they had a stroke, things like that, where they don't have as good like of, actual like foot either sensation or foot actual mobility, right? They're going to lean forward and they're going to want to like look at their feet while they're walking. So they're going to be looking down the entire time when they're walking. They're looking at their feet, they're looking at the ground because they're afraid, they don't want to like trip on something, etc. And so helping these people to make sure like there isn't rugs in the house, there isn't like huge floor bumpity transitions that they have to go through. There isn't dog toys, laying around everywhere, or kid baby toys laying around that they can trip on and stuff like that, will help them to give them a little more confidence, and stay upright, and keep their head up, and like when they're walking. So that's going to continue to just keep everything like stronger than having them, look down and look forward. But if you notice somebody starting to do that, that's kind of when you have the conversation like, hey, okay. If you were standing up straight and you were kind of looking a little more eyes on the horizon, straight ahead, looking at the ground, like kind of like glancing at the ground, taking a quick peek, and then kind of back up with your eyes. why do you not do that? Like, share with me, like, what are you afraid of? Or can you feel your feet? Tell me about how it feels when you're walking. And then that might spur more conversations about more types of services they might need. They might need to go see a neurologist and have things checked out, or something like that, orthopedic, etc. So things just to keep in mind. There's a lot of different ways that braces, like we can see like lumbar braces. There's braces also that you can use. Lumbar brace is going to usually be called an LSO. You'll see thoracic braces for this kind of middle upper back area that this lady has on here. That'll be sometimes called like a TLSO for like a thoracic, and then you have like thoracic lumbar if it's like the whole thing. But you want to make sure that all these kind of brace things, even on a knee, a wrist, is fitted properly, because otherwise they're going to dig. It's going to cause pressure. It can cause a lot of pain, which is the exact opposite of why we're trying to use those in the first place. Obviously, your PT and OT guidance is going to be really important to help with safety. So therapy and modalities, obviously we know, we just talked about physical therapy. Occupational therapy is great to help improve those like activities of daily living. We just talked about some of like the home safety things, like making sure there isn't stuff on the ground, on the floor, rugs, etc., that are going to move, that they're going to potentially trip on. Other things that can happen, that you can use now also for treatment, is like red light therapy, or sometimes you'll hear it called um, like deep tissue laser, or like cold laser as well. That can help reduce like inflammation and pain sometimes, especially like in joint areas and other areas of the body. Heat can be great sometimes for muscles. Obviously, sometimes, cold for anti-inflammatory purposes as well. And, just making sure to keep the patient engaged in that education process. So, arthritis specific management, as we talked about in the other video. So, you have like your osteoarthritis and your rheumatoid arthritis. But with both of them, you're going to have pain, you're going to have inflammation. And the biggest thing is, even though sometimes like it hurts to move, the actual moving of the joints at least a little bit themselves can help to continue to strengthen the muscles around the joint. That's going to help stabilize it, which is what we need. But also, when you move around, it also kind of helps, right, to pump the blood, pump the inflammation out, etc. sometimes. So you want to kind of keep that motion going to kind of help preserve some of that cartilage. We can, use kind of small amounts of movement over time. Also, you don't have to do like a lot of activity all at one time per se, but just like little bits of activity instead of like prolonged sitting. Because how a lot of times too, they'll say like if they sit for a really long time, or if they do nothing for a really long time and then they get up and try to move, they got to kind of like warm it up, right? Once they get warmed up, then they're like off to the races. Then they can walk and they can do whatever, then they're fine. So sometimes for us as caregivers, and also from a case management standpoint too, just asking them like, okay, like what does that look like? It might be that you don't try to like rush them out the door in 5 minutes if they have a doctor's appointment that you're trying to get to. You might need to give them 15 minutes because they might need the 5-minute warm up, right? They might need to be able to get up, walk around a little bit, piddle, pedal around with something over here, mess with something over there, and then their body's kind of warmed up, pain is decreased, and then they're fine. So, anyways, just kind of things for them to be able to keep in mind, which is good. And from a stretching mind body perspective, we've talked about that a lot. Obviously, the more their body is able to move, and move in a way that they, maybe used to be able to move, the activities they used to be able to do. Like again, things that we kind of take for granted. If we can get them to do those things, it obviously moving, as we found over the years too, like helps release like dopamine, endorphins, and ketones, like all these other things. So it helps produce all these different chemicals that are the like happy signals and happy, happy thoughts, etc., in our brain. So those are going to be like a direct correlation. The more somebody moves, the better, literally, sometimes like they're going to like physically and emotionally, mentally feel. So Tony Robbins always talks about, um from the perspective like motion creates emotion, right? So I'm going to say it again for the people in the back. Motion creates emotion. And especially for seniors, this is key. They need to get up, they need to be moving around to be able to create that better mental kind of state for them. Balance, obviously, balance training is good. There is a bigger movement the last couple years in doing like chair yoga. You'll hear that, see that sometimes, especially at some of these like independent living and assisted living, nursing kind of care type of homes. But something else that's kind of really making a comeback, which I think is super cool, is Tai Chi for older patients. And I think this is also fantastic because it's constant motion. It's slow, which that's good, but it's constant motion and back and forth. We kind of call it like bilaterally, right? Left to right, but it's also all kind of plane. So you're going to move forward, you're going to step backwards, but you're moving in the left, right, and anterior, posterior, like forward, backward plane. And it's fantastic for people, helping them to get a better handle on their balance, like I said, their proprioception, where their body is just in space in general, and keeping that, we call it that mind body connection, right? This is it, which is fantastic. And even better, bonus points if they can do any of these kind of things in a group setting, because obviously being around other people as well, that socialization aspect is really, really, really key. So anyway, just kind of cool things that they can do. And there's, a lot of these classes and stuff like that too, that we can now access because of our virtual world. We have access to all kinds of things now that we never did before. So, so getting them access again.
Sorry, I think our speaker disappeared for a second. Hopefully she comes back on.
I know. She said her
Sorry, I think our speaker disappeared for a second. Hopefully she comes back on.
let me get off of there. Um she was saying it died. So if she's not able to get right back up, let's see here. Let's just give her a couple of seconds here. That was really good information too that she was giving us about all the different ways that we can continue to move around and keep our mobility. It was really good. If she doesn't come back, we will resume with another opera talk next week. I believe we have some more coming, so just stay tuned for the announcements as we're announcing our Oh, there she is. She's
Oh, you're
back.
back. That was so weird. No, my laptop was like, it was totally charged. So that was like completely
So
strange.
crazy,
I
isn't
don't
it?
even know. Anyways, we're back. Okay, we just had two more slides real quick, so I'll do
Okay.
this yes for you guys
Here
here.
she is.
And we're back. Oh, let me just pull it back up here. 1 second. On the right side here. Okay, so this is kind of where we were. So just kind of talking about in general, again, anything that these people can do in a group format, bonus points, because it just helps, from the socialization aspect, etc., which is nice. So things we do need to talk about though is, on a daily basis, like if patients are starting to have pain a lot and other issues are kind of occurring, it's really starting to decrease their functionality, their quality of life. ADLs or activities of daily living are really starting to like go down. Maybe they're not doing stuff like they used to. Maybe they're not like taking a shower as much. Maybe they're not even like eating as much. Basic things again that you and I, kind of take for granted. Dishes are really starting to pile up, etc. You're going to see kind of visual signs that laundry, whatever, that things are kind of like not quite as status quo as they used to be. And that's kind of then when we need to start having the conversations again, the up and down the stairs, different things. Maybe they're not enjoying activities like they used to. We need to kind of start having those conversations. Like, okay, how bad is this really bothering you? And again, from a case management standpoint, caregiver standpoint, okay, maybe we actually need to go just do an orthopedic consult, or consult with a neurologist or neurosurgeon, or some whatever discipline it has to deal with for that particular part of the body. But the good news is now, from a surgical perspective, for some of these things, like it's very common for older patients. Like we have a little picture of hip surgery here. Obviously, this white structure. This is a pelvis X-ray that you're going to be looking at, bottom left. This white structure is what the actual hip replacement itself looks like, with two screws stuck in there. This is like the normal hip, but again, for some of these patients, like a hip replacement is fairly common as patients get older. Knee replacements sometimes, again, also fairly common. But a lot of times, people will put those off, as long as possible until they're, again, really starting to cause a lot of issues. But patients usually will do really well now with those kind of procedures, and recovery, is not super horrible. Maybe a month to month and a half, for some of these kind of things, like all in, depending on what they're getting done. But but usually patients are up and moving around, walking around, and all the things sometimes, within, a week or so, week and a half again. So it's kind of like a short-term timeout for, long-term gain for them to be able to have their function, mobility, and again, their lifestyle quality of life back, which is key. So obviously, like PT, doing the rehab, etc., after the kind of surgeries are great. The thing that can happen, I just want to address this quick here. The delaying too long can worsen recovery. So what can happen is that with this patient, we're going to go back to this pelvis X-ray down here. So let's say it actually would be this patient's like right hip here that got replaced. But let's say that this has caused, this right hip's caused a lot of pain, a lot of irritation, etc. For like, we're just gonna make this up, like a year. Okay. The issue is then, since the patient has been trying to avoid putting pressure on this hip, they now have started to put more weird, uneven, unbalanced pressure on their left hip, this other hip over here. So again, now they're going to start degenerating the left hip at a higher rate than what they would have if they would have just gotten, you know, the other hip addressed and surgically taken care of sooner. So, and again, sometimes otherwise too, the more you have the degeneration, like we learned in the first presentation, the grinding, or the, you know, the RA version, you're going to have sometimes also, especially more in the osteoarthritis, the grinding one, you're going to have decrease in that joint space, but your body's also going to make bone spurs. Okay. So you're going to have these like pokey things that are going to be sticking out in these little, I call them, it kind of looks like little projections that the bone will actually grow off of it in, you know, kind of like different strategic directions. But what happens then is the bone spurs is obviously, it just sounds painful, can then obviously start poking into tissue themselves and cause pain and inflammation and all kinds of things. So not only did you have the pain from the actual, you know, arthritis and inflammation from that, you now sometimes can get pain from the bone spurs, because now the bone spur is like poking into the nerve area or joint capsule or other things as well. So again, like sometimes when we don't recognize these things and get these people, you know, the support or care that they need sooner, it can definitely prolong obviously them from getting treated, but also, you know, prolong healing, because we're now going to have secondary issues we're going to have to potentially also address besides just the primary thing. So biggest takeaways is, you know, movement is medicine, right? Medicine for our body, physically, medicine for our mind, and just keeping all of those strong is going to be key as we continue to age. Like I said, we can give these patients a lot of different really cool supportive tools and resources that we have nowadays to be able to allow them to preserve their independence safely. Keyword here is safely, a little bit more. From a case management standpoint and even caregiver standpoint too, like early referrals and getting them partnered with the right resources earlier on in the process is going to help to improve the outcomes for these patients. And even with that being said, like I have spoken about, you know, we got to look at what's right now, like what's the fire, you know, like, you know, no pun intended really, but like, you know, like what's the right now, you know, crisis thing that they have going on that we need to address right now. And then, okay, what does this look like then also down the road, and making sure they have those referrals and kind of those resources as well on both sides of that is going to be key. So education, obviously, also for the caregivers and also for the clients is going to be important. But little small changes matter, like we talked about. You know, them making sure they're fully engaging when they're walking, fully engaging their muscles from a sit to stand, etc. Those things can be, you know, can be key. Your PT and your OT, especially now that we have really great home health resources, etc., and really good like cardio rehab programs and things like that, can really be awesome resources for these patients and their families. And you know, prevention reduces long-term cost, like as we discussed earlier about, you know, the burden financially on the healthcare system as a whole. The more we can get these patients actively participating in their own care is going to be key. But you know, we have to keep things strengthened and keep things functionally moving, so that we don't have the crisis, constant ER admittance type of situations for the same kind of type of conditions. So otherwise, that is all I have for you guys for today. is there any questions or anything that you
Let's
have that you need more clarification on?
Well, it doesn't look like there are any questions from anybody in the comments or anything, but doesn't mean that you may not have any later. So if somebody by any chance would actually happen to have a question or something of that nature, is there a way to get in contact with you? Or would you like them just to get in contact with us and then we'll put them in contact with you that way?
Yeah, yeah, do
Okay.
that. Just have them, yeah, get in contact with you since they'll
Okay.
have your
So just
info. So yeah,
contact Aging Advantage, and we will most definitely get you in contact with Dr. Jennifer Martin for any questions or clarifications or anything of that nature. Once again, thank you so much for coming on and sharing this wealth of great information that I'm sure that we all have learned something today and can continue to operate and help us just to be healthy. Like you say, in our mind, starting there, and then it will just continue to flow into the body. So again, we will return or resume. Keep posted for another ARPA talk coming up next week. So if you enjoyed this, you got something out of it, you want to share it with others, please do so. Also, after the Facebook page, always get onto our YouTube channel at Aging Advantage STL so that you can see our library of information that we have. You're always welcome to it. Again, Jennifer Martin, thank you so much for coming on. We appreciate your time and sharing all this great information. You guys take care and have a great day.
thank you.
Bye bye.